right. A diagnosis of Gittleman syndrome is expected. What is the most appropriate initial treatment? Okay. This is like a treatment question. 28-year-old woman is presented to her primary care physician complaints of recurrent muscle cramps, fatigue, weakness. Lab tests show hypokalemia, hypomagnesemia, and metabolic alkalosis. Her blood pressure is 105/65. Diagnosis of Gittleman syndrome is suspected. What is the most appropriate initial treatment? I don't remember what Gittleman syndrome is. Let me see if I can still try to figure this out. Muscle cramps, fatigue, weakness, low blood pressure, hypokalemia, hypomagnesemia, metabolic. Okay. Oral potassium supplementation, spironolactone. Well, if our blood pressure's low, I don't think I'd want to give any of these diuretics. So I'd get rid of the middle three ones. Mineral corticoid receptor antagonist. Well, if seems like she's low on salt, I don't know if I would want to give I think if anything, I'd want to give an agonist to pump that up. I don't remember what Gittleman syndrome is. I definitely have heard of it. Just based on this, the hypokalemia and the low blood pressure, I think I just give potassium supplementation, but I'm not sure.
Okay.
Really not sure.
So so I'm gonna work through it too. I agree with your answer choice here, right? But just to see kind of, I want you to compare and contrast, right? So most person initial treatment, I'm reading this, I know it's for sure it's a nephrology question, right? There's no doubt about it. 28-year-old woman, right? PCP. She has muscle cramps, fatigue, weakness. So I know she has an electrolyte issue, right? From the answer choices and from the chief complaint, she's young too. She shows hypokalemia, hypomagnesemia, and metabolic alkalosis. So that can definitely, support why she has these symptoms. And her blood pressure is soft, right? It's not super. She's not super hypotensive where she's like dying, but it's soft. And then she has Gittleman syndrome. So Gittleman, right? Even though I can't remember exactly where on the nephron that it messes up, but I remember that these special nephron diseases, which are rare, they act like diuretics. So I know that it's like she has a built-in diuretic, which is not good for her, right? She's cramping and stuff. So in my mind, I need to replenish her volume, which obviously B, C, and D, like you said, right? That's going to make it worse and make her blood pressure softer, which is never good. And then mineral cortical receptor antagonist, she already has issues with her electrolytes that probably won't make it better. So the only one in my mind that will help her electrolytes now, right? Excuse me, is potassium, right? It's not going to really help with her soft blood pressure, but at least you start correcting some of her electrolyte abnormalities. So I agree with you. A would be what I would choose. Okay, does it make sense? Kind of how I work through it. It's very similar to kind of how you did it, but I kind of want to start doing a little compare and contrast so that you can be like, okay, so where do I want to make it a little bit more clear in my mind? I'm not sure if that's helpful to you or not.
Yeah, I think so.
Okay, perfect.